Good morning, everyone. Dr. Tam here, your health and pain specialist here in Vacaville, California, where every single day I want to give you tips on how you can improve your health, function, and longevity. Today, I want to talk to you about fluidity in your shoulders, hips, and knees. Why those three joints are the most worn down joints that I have seen in our office. Shoulders, hips, and knees. Why are these three joints so important? That's because your shoulder is the most movable joint in the body, second by your hips, and then your knees is what I have seen in practice, one of the most worn down joints in the body. How do you preserve it? Well, what happens is during the winter time, your fluid, blood flow to those joints is not as good. They're in your extremities. So how do you preserve them? Yes, of course. You might say, well, aren't there knee replacements, shoulder and hip replacements, the advances of medicine? It's so great, I can just get knee replacements, for the rest of my life. Wrong. You can get up to 2 knee replacements, and they're not guaranteed to take away your pain. But every time you get a knee replacement, what patients do not realize, and this is coming from an orthopedic surgeon that I talked to, he mentioned that, well, it's like an amputation every time you have a replacement, because you're literally cutting off the lower part of your upper leg, the top part of your lower leg, and inserting some metal pieces in there and hope that it works out and hope that it lasts more than about 10 to 12 years. On average, he tells me that's how long it's going to last. But you can only do 2 of those in a lifetime. And I said, well, that's not good. So he says, yeah, the problem is that people are wearing down their knees and hips so early now that when they start wearing it out in their 40s, you replace it in their 40s, in their 50s, they might have to replace it again. And by the time they're 60, they're out of luck, okay? So there's nothing much they can do. So the first thing is I want to show you is how do you preserve them? Yes, you want to use them. Sitting on your butt all day is not going to preserve them. It's not going to help you preserve them. You have to use it or lose it, okay? But it's how you use it. So here's what you do. First thing in the morning, especially if it's winter time. You can see because I'm wearing a jacket inside my car right now. First thing that you do in the morning, make sure you just get up and move your shoulders. Do some shoulder rolls. Go forward 10 times, backwards 10 times, reach up 10 times, reach out to your side and back 10 times, right? Now for your hips, do some hip abduction. That's abduction. Kick to the side, kick back 10 times each. Do some light squats, non-weight bearing, okay? Maybe some walking lunges 10 times. Get some support. Maybe hold on to a wall or table, lean against something if your knee or hips hurt, okay? Get some fluid in there. Go out for some walks. Do stretches. Make sure you do your stretches at least 30 seconds, all right? So on top of moving your shoulders a certain way 10 times, 3 to 4 ways, move back, go back to the video and watch it. Arms, shoulders, forward, backwards, reach up, down, and to the side 10 times. That's 5 movements for the shoulders. Then your knees and hips, kick to the side 10 times, back 10 times, do some squats 10 times, walking lunges 10 times. That's 4 movements in the hips and knees. That will help you preserve your joints as long as possible. Go for walks, get moving, right? And maybe if you like running, don't run on hard pavement. Run on maybe dirt or on a track or on a treadmill, all right? So these few tips will help you preserve your shoulders, hips, and knees in the long run. For those of you who have arthritis, make sure that you have it looked at, okay? Regenerative medicine is something that's been great to shown in history to help people with knee and shoulder problems. Make sure your body's also in alignment. That's huge. Make sure you're taking all the supplements that you can, all right?